Hello, I wish to present the presentation for the free paper, Surgical Aortic Valve Replacement Outcome in the Elderly, paper published by Arvind, Nanda, Ign, and Dato Izani from the Department of Cardiothoracic Surgery, National Heart Institute, Kuala Lumpur. So the background, average life expectancy in Malaysia is increasing over the years. Latest estimates from the Department of Statistics places the average life expectancy of a Malaysian at 74.9 years. So with the increasing mean life expectancy, there's an increased percentage of elderly population. Aortic valve disease, specifically aortic stenosis, is the most common valvular lesion among elderly patients. Age-related degeneration is the most common cause of AS in patients older than 70 years. Most centers worldwide are still skeptical of the mortality and its associated morbidity accompanying this procedure in the select age group. So the purpose of this study was undertaken to evaluate a single center in-hospital morbidity and mortality for isolated AVR in the elderly population. Below are the characteristics evaluated in this study. Patient characteristics, patient's age, and the patient's primary diagnosis requiring the surgical intervention. The surgical characteristics, type of surgical valve replacement performed. The outcomes or endpoints that was evaluated, hospital mortality, average hospital and ICU stay, and surgery-related morbidity, which is arrhythmia, new onset acute renal failure requiring renal replacement therapy, and cerebrovascular accident. The methods. Retrospective analysis was performed on all patients aged 70 years or older who underwent isolated AVR from January 2015 to December 2019 in IJN. Inclusion criteria was any patient 70 years or older in IJN, regardless of the pathology of valve or the type of valve prosthesis. 51 consecutive patients were evaluated who were 70 years and older with a mean age of 75.8 years, ranging from 70 to 87 years old. Patients who underwent any form of concomitant surgery, regardless whether it's a CABG or any other valve involvement, mitral, tricuspid, pulmonary, or aortic root or ascending intervention, were excluded from this study. The grade of aortic stenosis and regurgitation requiring intervention were defined as outlined in the ACC AHA 2006 guidelines for the management of patients with valvular heart disease. Patient survival and post-operative stay and its complications, which was the primary outcome of interest for the study, was assessed by evaluating the in-hospital documentation along with discharge summaries and external reference. So the results of the 51 patients, 68% or 35 patients had aortic stenosis, 18% had aortic regurgitation, and 14 or 7%, 7 patients had a mixed aortic disease. Type of valve replacement, 98%, 50 patients of the 51 had a tissue valve, only 1 patient had a mechanical valve. This is the average post-op stay, highlighted by the green dots and the green line. And the average ICU stay is the orange dots with the orange line, the mean being 5 days for the average ICU stay. Endpoints, 12 patients or 23.5% developed arrhythmia post-operatively. 10 of them AF, 1 SVT, and 1 VF. However, all of them reverted back to the original cardiac rhythm prior to discharge. It's arrhythmia, 12 patients. 39 of them had no arrhythmia. 2 patients, 2.9%, developed acute renal failure post-operatively who required renal replacement therapy. 3 patients, or 5.9%, developed CVA, none of which were hemorrhagic in nature, and 3 patients died, which is 5.9% as well of all. So in conclusion, surgical aortic valve replacement in the elderly is associated with acceptable morbidity and mortality rates. Surgical intervention should remain the gold standard of therapy for patients requiring aortic valve intervention in the advanced age. Thank you.